Hello, and thank you so much for tuning into my podcast. My name is Kara, and I'm a holistic health practitioner for both people and pets. After working for years in the conventional medicine field, I realized that while our lifespans may be getting longer, our health spans are rapidly shrinking. And when it comes to our pets, both their length and quality of life are decreasing. When I turned to functional medicine and a more holistic approach to health, I saw dramatic improvements for my pets, myself, and my patients. Join me each week as I merge natural health for people and pets by focusing on the root cause of disease and applying raw, real remedies that you can use to improve overall wellness for every member of your family, including the furry ones. Hello, and welcome to this week's episode. Today I welcome back a returning guest, Dr. Margo Roman. When she last appeared on the podcast, we discussed how she pioneered microbiome restorative therapy, and I highly recommend listening to that episode, which was episode 21. But today we discuss a very serious topic, and that is the ongoing battle that she has been fighting against the Massachusetts Veterinary Medical Board, who suspended her license after they determined that she had practiced outside her scope of veterinary medicine by daring to discuss how ozone could protect human members of the family in addition to animals. This targeted attack on Dr. Roman is one that I feel affects us all as holistic advocates, and is part of the reason why many of our well-known and loved DVMs allowed their licenses to lapse or left them after they were also suspended for speaking out about holistic topics. I hope once you listen to the episode, you'll consider sharing with the holistic community to raise awareness about the situation and advocate for our holistic vets and our pets throughout the community. All right, everybody, and we are back with Dr. Margo Roman. So Dr. Roman and I, we're going to talk about some really heavy stuff today, but of course, as always, I want to thank you for giving us your time, especially in the middle of all of the stress that you have been going through and all of the legalities. So thank you so much for taking the time to talk to us today, because this is a really important subject and not enough people are aware of what's going on.
I agree. It's really an important one. And to be able to use your veterinary knowledge and skills and follow your veterinary oath and keep studying and using and I want to read the oath to people so they know why I'm standing up so hard for this veterinary oath, because it was given to us by the AVMA. You know, they've changed it a few times over the past 7 years that I've been a veterinarian, but it really has stayed a core that you're supposed to use your scientific knowledge and skills for the benefit of animal, human, and public health. And it's always been that. And we're supposed to have continuing knowledge and skills so that we can add to it and make ourselves better. And that's where I have been trying to bring that forward in the state of Massachusetts. And there's been such resistance because they don't want to learn anything else that they didn't learn only in veterinary school or only at a CE at some other places. But the CE on integrative medicine is all out there. So we're getting all this race approval for education on all these modalities, and we can't talk about it. And that to me is like so sad that I can't talk about it.
Yeah. It is very frustrating. And I think it would be a great idea actually for you to just start out by reading the veterinary oath to us, because it's very similar to what we have to do in human medicine, nursing, and also doctors. We have an oath. We vow to uphold it. But unfortunately, there are a lot of things in traditional medicine that are actually causing harm. And people don't realize that that's the case because of the way we're trained. So can you read that oath for us?
Sure. You know, I have a huge copy of it that sits above my waiting room, and I must, when I'm at work, which I haven't been in almost 23 months, I walk by that thing 12, 15 times a day, and it's very important to me, but it's being admitted to the profession of veterinary medicine. I do solemnly swear to use my scientific knowledge and skills for the benefit of society through the protection of animal health and welfare, the prevention and relief of animal suffering, the conservation of animal resources, and the promotion of public health, and the advancement of medical knowledge. I will practice my profession conscientiously, with dignity, and keeping with the principles of veterinary medical ethics. I accept as a long life obligation the continual improvement of my professional knowledge and competence. And this is where myself as an integrative veterinarian, and there are hundreds of people that do what I do, and maybe even thousands of now that are doing all these modalities. If you have a veterinary board that doesn't understand them, to them it means nothing, and the education that you get in that area means nothing to them too as well. So
Yeah.
it's very, 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 frustrating to me to to look at that. So I just want to
Yeah.
go back to watching you, where I'm trying to get back into that. I don't, where is that?
Oh,
I lost you. I lost you. I gotta find, because I had to
well,
read
that's
it all.
okay. While you figure that out, I'm going to just say to the listeners here,
Oh, here it is. Okay.
I would love for everyone listening to pause and maybe even go back and re-listen to that oath. And I want you guys to think about what that means. What does that mean to you? What do you think it means to veterinarians? And what does it mean to your animal, right? Your furry family members,
Mhm.
to be able to have that oath upheld, because they're not just empty words, right? It's a promise that you make as a veterinarian, and then to try to uphold that and not be able to do it in the way that resonates with you, I imagine, is infuriating.
No, I guess they can go back and listen, or you can even just Google veterinary oath and read it again.
Mm-hmm.
And and again, it's just, if you can't practice with your knowledge and your skills, and you learn something, and you've anecdotally had a case and it worked, and you did another case with the information that you got from
Mm-hmm.
NAVC, from a conference that was on acupuncture or on ozone or on homeopathy, and you got that knowledge and you use that. If
Mm-hmm.
the board has any word on it, they don't care about it. It's not part of their veterinary practice that they do,
Yeah.
even
It's
though,
not the double blinded,
well,
controlled.
many of them are now. I mean,
Well, yeah.
the information that I did on microbiome now, and I've been doing it now almost 30 years, protecting it. And
Mm-hmm.
literally, I've been working with microbiome for 30 years and doing fecal transplants for over 13 years.
Mm-hmm.
And I put it out there, and you literally thought I was full of crap. I mean, serious. And I'm going, yeah, I am, but the
Mm-hmm.
immune system is so valuable to me to be
Yeah.
utilizing that. And it's just that science catches up with people that pioneer other ideas. And so finally, it is caught up in that respect with the microbiome, because
Yeah.
in 2000 there was only one research article on microbiome, and
Mm-hmm.
2017 there were 17,000, and then in 2023 there were 250,000.
Mm-hmm.
And so many of the cases that I saw, because I was willing to try something else and not jump on
Right.
the antibiotics and jump on the NSAIDs and jump on the steroids and jump on all these things, I got to see how a body could actually heal. And by
Yeah.
allowing its immune system to navigate its health seemed like such a logical thing to me.
Mm-hmm.
And now it's being understood and people are respecting it. But if you
Yeah.
don't have the tools to navigate something without an antibiotic, without a nonsteroidal, without some kind of drug or surgical procedure, you don't have another way of doing it. And sadly, that can be death to an animal, because if somebody can't
Yeah.
afford $9,000 worth of surgery or chemo or whatever, they have other options, but they're not advised about them because it's not standard of care. And that's when we
Right.
get into the spectrum of care. But these
Yeah.
are all another topics that are, but the point of having this gathering right now is for people to understand why we're going to the United States Supreme Court for freedom of speech and health freedom and protecting our veterinary oath. And that's what I've been working on right now. And it's been going on for 21 years
Wow.
at the
You know,
cost of over $1 million to myself personally.
oh my gosh,
And
Dr.
it's more than that. It's more than that. So
Yeah.
I need
Well, it's
people
not
to
just
support
money
my
that's the
health.
cost, right? There's the
No,
emotional
it's
cost, there's
this
the
this gray
professional
hair,
cost.
this is a lot of this, or lack of hair, is due to that. And because I always wanted to be a veterinarian from the time I was a little
Yeah.
kid. And I felt like the cases that I saw as a child moved me to say, that's not right. We shouldn't do it that
Yeah.
way. And
Yeah.
that's a backstory that I need to share with other people at some point. So,
Yeah. Well, I mean, I would love for for you to share that, because I feel very similarly in terms of what I have done for human medicine, because I've spent all of my career in a hospital. I did emergency, I did ICU, I've done inpatient, and I have been conventional all of that time. And finally, my eyes were really opened, first because of my animals, and people know that about me, so I'm not going to reiterate it. But a lot of it was just compounded by where I have worked for the past few years and how I would feel like what I was doing is not the correct, well, not that it wasn't correct, but it wasn't the only way, right? Like a lot of times it was presented as my way or the highway. These are the peer-reviewed studies. This is our policy. This is just what we do. And it's really frustrating knowing that there are adjunctive treatments or different modalities that you could use and combine that I think would really actually improve the health of the patient. And those things were not heard. And so now, having just moved back home, I'm working in a primary office where I get to practice integratively. I get to talk to people about herbs, and I get to talk to my colleagues about natural medicine. And it's so wonderful, and it's much more fulfilling than where I've been before. And my dog just booped the camera here, so it's shaking all over the place. But it makes me think about, there's a physician, her name is Dr. Elizabeth Wall. And Dr. Wall was diagnosed with MS when she was younger, and this was probably 25 years ago now. And kind of similarly to what you had said, she tried all of the conventional things, and her MS was persistent and rapid, and she ended up wheelchair bound. And she finally said, "This is not working. There must be another way." And she turned to natural health and supporting her microbiome. And within a year of doing that, was walking again. And when she tried to publish her studies, she got denied. She was asked to step down from her educational board, and it took her 12 years to get her studies on the microbiome published. And she was her first clinical trial. Everything she did for herself, she started doing with other people, saw results, and she got laughed at. And it took her a decade. And so you saying that
I would
you've
love
been
to meet her
21
because
years of this, I mean,
it is so frustrating.
it is.
And you know,
So tell us
well,
your backstory.
well, I mean, I was thinking about an early backstory because I wasn't even going to start with these, but I was talking on my hike with my person that walks with my dogs with me, and you know,
Yeah.
even as a child, I had my parents wouldn't let me have an animal, and I had to collect soda bottles and make enough money to pay for the animal, pay for the dog, plus pay for all its veterinary care for a year before they would let me even get a dog.
Wow.
And they were just, you know, and so I bought a little wire hair fox terrier, and I mean, his name was PJ, and I trained him and did all this stuff and took him to a dog show, and my sister was walking him, and he must have gotten into some kind of rat poisoning, and he started
Oh
hemorrhaging.
no.
And of course, I'm like 9 years old, and what do I know about it? So, you know, I said he got into rat poisoning, and the vet told me he had hemophilia. And I had learned in like school about genetic, you know, it was really early, like I was like 10, I think, about, you know, it was a word that came up. And so how do you investigate that? How do you know, you didn't have a Google, you couldn't. And I said, well, it's supposed to be hereditary. And so I called the breeder, and she said she never heard of it before. And I thought, well, when he had his tail docked, he should have bled to death, and he's cut his paw and he didn't bleed to death. Why is he bleeding now? And so when I tried to talk to the vet, he wouldn't talk to me about it. So I saved up, I had money that I had, and I called Animal Medical Center and talked to the pathologist
Yeah.
there, and they said, no, it's never been found in wire ear box terrier. I mean, this is someone
Uh-huh.
who's 10 years old,
Yeah.
12 years old, whatever, trying to find out, why he was bleeding. And my vet wouldn't talk to me about it, didn't want to acknowledge that he didn't
Oh
know. He
my
wouldn't say
God.
he didn't know. He just wouldn't acknowledge it. He just said that's all, that's what it is.
And
And
that could have been easily, I mean, maybe not easily,
no, no,
but a
well, I mean,
vitamin
I
K
wanted to treat
infusion.
him, and I found out treating him with vitamin K. I mean, these were things
Yeah.
that were already there for
Yeah.
coumadin poisoning, and
Yeah.
he insisted it was hemophilia. And I was like, I lost this dog who it was my
Oh.
first thing, whatever, and it's just really hard. And then we had a small little dwarf pony that had club feet, and this was a farm we used to go to as children, and it was like the highlight of my summer as I get to spend time on the farm with this pony breeder, and this they didn't have the money to fix him, so they gave us the pony, and we were supposed to take it to University of Georgia, and then we lived in Florida, so we were going to take him to equine specialists and figure out which way we wanted to do it. And we took him to the University of Georgia, and they said, let's build a leather boot to move the foot so that the foot would move over. And I thought that sounds like a really good idea. And then we said, well, we better talk to the equine specialist. And we went to Ocala, and the guy was really arrogant. And he said, oh, no, we got this new epoxy that we can move the hoof and shape the hoof and make it do it. I said, no, I just really want to do. And he's like intimidating me, like, you don't know what you're talking about. I know what's going on.
Yep.
We have to do this surgery, and I will do it for like cost, because I think this is the right thing to do for this horse. And I was like, no, I really want to try to remove this is just a baby. I don't want to do such major
Be
surgery.
conservative, work with
Right.
the
So
body.
body and try. And so this was like, it was a little kid. And
Yeah.
they basically, did the surgery, put him on antibiotics, and he died from the antibiotics. He went into complete salmonella infection. And we did, complete autopsy on him at the state lab because it was so
Yeah.
unusual. And he died from salmonella overgrowth from antibiotics. So here I
Yeah,
have a
super
case where, you try to do something, and the veterinarian's too arrogant. You try to do something, the veterinarian's too arrogant. You try to be conservative, and then you use antibiotics, and it kills the animal. So you've got these kind of vibrating things in my brain as a child. And so all the other things that went on in veterinary school, and being able to, I was so fortunate in veterinary school to be the first woman to take the veterinary acupuncture course in 1975 as a student, and watched what acupuncture could do, and invited the Marvin Kane, who was one of my teachers, to come to Tuskegee and give a lecture on acupuncture. And he took two cases that were dead end death cases at our school at the time in 1975, 76. And one was a colic in a horse, and the horse, and at Tuskegee in 1976, every horse that they opened up and tried to fix the colic died. And in the dachshund who was paralyzed, every back surgery that they tried to do, and the guy was, the head of the clinics, but he was trained at Angel, but every one that he did, they were paralyzed. At least while I was there, they never walked again. So they were two really dead-end kind of cases, and he did acupuncture on both of them, and the horse pooped in about 20 minutes, and the dog could stand after the treatment. And so
Gosh.
in my eyes, it was like, oh my God, look at the opportunity here. And
Yeah.
the school just ignored it. It was like they didn't want to hear it, because their agenda was to do exploratory surgery on the horse, which would have been dead end. And the laminectomy, we didn't have air drills now and all that stuff. But even if we did, I'm still doing those kind of cases, not now because the veterinary board has my license suspended
Yeah.
till November. But those kind of cases were my normal cases every, I didn't get backs every month or whatever, but we just got them to walk again using ozone and acupuncture. So it's like, if you can see another way, then why aren't you at least trying that before you go down the road of just, we got to do surgery immediately, right?
So I mean, I hear how these things like set you up to see how integrative medicine can give you more options, a better approach in many cases. And obviously that's the way you practiced for a long time. But what is the law in Massachusetts about integrative veterinary medicine? Like, is integrative medicine inclusive in the Practice Act?
Yes. So in
Okay.
2008, we were able to change our Practice Act to include integrative medicine, which included
Okay.
acupuncture, homeopathy, ozone therapy, because of my horse, and because we stood up and we went all the way to the Supreme Court too as well, but to the veterinary board, that here are these other options. So it became
Wow.
part of our Practice Act. And I thought by then the boards would say, okay, we need to have knowledge of this. We can't just condemn it. And the Massachusetts Department of Animal Regulation, they have no knowledge of it, so they condemn it. So it's like,
Yeah.
if you live in a state where they all know everything, and they're not willing to say, I don't know this and let me learn it, I find that a real problem when in our profession, if you can't figure it out, you can euthanize them in 10 minutes and have them dead on the floor. And you never tried acupuncture or homeopathy or
Yeah.
herbs or chiropractic or ozone therapy or fecal transplant. You don't have to, because even though it's in the Practice Act and some insurance cover all of it, Fetch covers it. I love it because they cover all this stuff. Trupanion used to, and they don't now. So I don't recommend Trupanion anymore. But they used to cover all this stuff, which if I can save an animal from having a leg amputated by doing ozone, shouldn't I do that and not have
Yeah.
to have it done? I mean, that is something that I think is important.
And I'm not sure why you shouldn't even have to ask that question, right? I mean, it's crazy that the argument even exists against trying a modality like that. Where is the harm in trying? There is
I
no harm.
I don't think there's any harm. I mean, sometimes these things don't work as fast as an antibiotic, but we as veterinarians have to stop using antibiotics. 1.3 million humans are dying every year from antimicrobial
Antibiotic
resistance.
resistance.
The World Health Organization, the USDA, the AVMA, everyone says you've got to stop using antibiotics. Then when
Yeah.
you offer these other things, oh no, you can't do that. Well, what are veterinarians going to do? Either use the antibiotics or euthanize the dog. So
Yeah.
I feel like there's so many other ways to address it, and they may not be successful, but I've had dogs go into complete autoimmune hemolytic anemia from antibiotics and died. So how do just because you have an antibiotic that you can use doesn't mean it's going to be safely used in that particular animal. So if there is a way to get the immune system stronger, have the body heal, not disrupt the microbiome, and one course of clindamycin from a dental can disrupt their microbiome for a year and they may never get it back. And it's
Yeah.
standard procedure to give antibiotics after dental. I haven't used antibiotics after dental in 30 years. 30
Yep.
years. Never had a problem. And their
Yep.
gums heal faster. And I
Yep.
don't have the disruption. And I'm trying to tell the dental people, and they're like, oh, we have to use antibiotics. No, you don't. You are causing that 1.3 million human possible deaths because they blame it on veterinarians, they blame it on indiscriminate physicians, and they blame it on farmers. And with all the opiate overuses that has happened over the last 15 years, and now people are really,
Yes.
condemning that, that may come backfiring in veterinarians' faces. You used antibiotics and developed MRSA, and the person got MRSA from the dog, and we're going to blame
Yeah.
you. You know, so
Yeah.
it's really important that they have another option besides using antibiotics, and ozone works phenomenal for that.
So I really love the connection that you just made about how, your dog could get C. diff or your dog could get MRSA and they could in fact pass that infection on to you because these bugs are indiscriminate. They don't care if you're a cat, dog, human, right? So one of the issues that I think sparked this ongoing legal battle for you was that you dared to discuss with your clients, right, your pet parents,
Hmm.
about how, COVID in 2020,
Hmm.
how that could potentially affect the home in ways that you could protect yourself. And because of that, I think the issue is that they're trying to say that you are not a part of the care team as a veterinarian. That's outside your practice, like outside your scope of practice.
Hmm.
You disagree, and I do too. I would love for you to talk to us about that.
Okay, so veterinarians, we're supposed to be part of a healthcare team, the
Mm-hmm.
USDA, veterinary ethics, the World Health Organization,
Yeah.
and we're part of, especially if it's zoonotic. It's if it's a
Mm-hmm.
zoonotic disease, and of course, at that time we thought it was coming from animals in the wet market, in China, and we've had coronavirus in dogs, we've had coronavirus in cats, so it is a virus that can affect animals. So for me, as someone who was trained in the 90s on bioterrorism and preparedness and was considered the expert in 2001 after 9/11 and lectured at the Tufts Expo as the expert on bioterrorism preparedness, I had all that background, right? Plus,
Yeah.
I had knowledge of ozone therapy.
Mm-hmm.
And ozone therapy in 2003 and 4, I started using it. And I had a kitten that came to me that was sick. And she got it from a cattery in Maine. It came down and had snotty nose, and I gave it Ozone, some sub-Q, and some vitamins. 2 days later, she calls me and she said, the cat's really, really sick. She called the cattery in Maine. 15 cats had already dropped dead, and the other 15 were dying. And she said, it's been an outbreak, and they thought it was coronavirus. They weren't sure because we don't have PCRs back then to
Yeah, yeah.
identify these things. So in my mind, I thought it's got to be either coronavirus or calicivirus, but calici doesn't kill my cat. So let's say it's a coronavirus, or let's
Yeah.
to me. So for that what 17 years or whatever, I always thought that it was, ozone was a possible cure for coronavirus. And I've been traveling around the world lecturing to human physicians, medical schools, veterinary schools, conferences on ozone therapy and antimicrobial resistance, antiviral, potentials for a lot of different diseases. And so I wrote an email to my private clients, in a private email to my private clients who all know I use ozone therapy, about utilizing ozone in their animals. So if their animals get coronavirus, we can't, animals can be fomites. And what a fomite is somebody coughs on your dog who they have COVID. Your dog has COVID all over its hair. What are you going to do? Dip them in Purell? What are you going to do, with the dog?
Dawn dish soap.
I don't know.
Yeah.
I mean, maybe Dawn would have worked. I don't know. I never tried it. I didn't do cultures but if you
Yeah.
can make ozone water and wipe them down with ozone, and if they get an upper respiratory infection, you can use, there's ways of delivering ozone through bubbling through olive oil that they can breathe it and get rid of it in their lungs. And I've had,
Yeah.
after, COVID started, I had a positive corona dog who, had, this is after the fact, but it proved to me that it totally worked, was positive for coronavirus and was so sick on 2 different antibiotics and was on medication. The dog couldn't breathe. And you know, we did the ozone, and the dog was fine on the way home. But that's jumping ahead than this story. So to put that out there, and then utilizing ozone to re-sterilize your PPE. Now, in 2020, in March, they were telling veterinarians, give up all your PPE, do not use it. It only can be used by doctors and hospitals. And I'm saying, no, I'm not giving up my PPE. Personally have a paralyzed diaphragm and no spleen. I live in PPE on a plane. I've been doing that for 47 years. Okay. I'm not giving it up. I'm going to re-sterilize my stuff. So using ozone to re-sterilize it. And they started doing that with hydrogen peroxide. But that was like 6 months later when they had enough PPE. But in that interim time where they didn't have it, they were starting to use it. So I made mention of that. And I also made mention about utilizing it to clean your vegetables. So if you're coming in from, the grocery store, you don't know if somebody had COVID and they coughed all over your parsley. You can just make up ozone water and dip it. And of course, it makes it last a lot longer too. So, because it's oxygenating the whole thing. So I made that suggestion, and they said I was practicing human medicine without, past that scope of veterinary medicine. I never treated anybody. And so as part of the healthcare team of veterinarians and doctors working on zoonosis, what can I do to protect the pet from contaminating the people? That was my job as a veterinarian, not according to the Massachusetts Veterinary Medical Board. Nope, can't say anything. And they've been out to get me for 21 years. And that's the backstory I was hoping to tell, was this backstory of why there's such hatred for me by this board. And in 2000, I rescued a horse that was supposed to be euthanized in late 90s. And he was 16 years old, and he had terrible allergies and was going to be euthanized in Florida. And I brought him up here because he was supposed to be this phenomenal horse, which he was. And he came off the transport, and he looked like a scab with scabs everywhere and just terrible. Well, I worked on him for like 6 months with acupuncture and herbs and homeopathy and nutrition. And he started jumping in horse shows. My daughter was showing him. He was wonderful. And then at 20, so 4 years later, he developed cancer in his third eyelid. And when I first started practicing, I was doing equine too. And I had 2 clients, one that was definitely in my care, went to Tufts, had the third eyelid removed, and within a year and a half, the whole thing metastasized to its head, and it was dead. The other one was an animal owned by another, by the same owner, but a different animal that I took care of. Same thing happened. So within a year and a half, the horse had died. So I thought, no, I'm going to address it holistically. So 6 years later, so he had lived 6 years. The tumor had grown large enough that it was irritating the eye, and he was in pain. And I took him to Tufts, and they said he'd be dead in 2 days. And if I didn't euthanize him, this is in front of everybody, that's because I was on faculty there for almost 25 years, that if I
Yeah.
didn't euthanize him right then, I was malpracticing. So I said, no, his blood works normal. I want his eye out. No, he's going to be dead in 2 days, 3 days. You got to euthanize. I'm like, where? And I
Yeah.
didn't, I took him out of there. He had surgery and he lived another 2.5 more years jumping in horse shows and getting ozone. And that's how I discovered ozone because I had started doing it and then I started to do it. And it's because of his success that I started to use it on my small animal cases. And that's
Mm.
how this book behind me got written because,
Yeah.
hundreds of cases teaching almost thousands of veterinarians around the world. And it's such a beautiful modality and has the potential to be antiviral, antibacterial, antifungal. It stimulates the mitochondria. It gives oxygen to the heart muscles. It's such a beautiful, easy thing for everyone to do, whether they're a pet owner and they want to get one and have in their home to help their animals, or as veterinarians can do it in a lot of other ways. So that whole piece, and so that happened in 2004, and in 2005, and this is going to interest you because you're doing diet. They had a lecture that was at Tufts, put on the internet, on the hazards of feeding a raw diet. You should never give your animal raw food. So about 70% of my clients were already feeding raw diet because I've been doing it 40 years.
Yeah.
And so I was like, wait a second, I want to find out why they think it's so dangerous, right? And so I called ahead and they said, and it was Lisa Friedman, who is paid by the dog food companies.
Oh boy.
And so they had this lecture and I called ahead and they said, there's no charge. Everybody's welcome. Bring as many people as you want. Please come. I'm dressed professionally in a suit with two or three of my clients and they come up and said, you can't come in here. And I went, what? You can't come in here. And I said, what do you mean I can't come in here? I said, I called ahead. There's no CE, there's no cost, there's no registration, everybody was welcome. I live in this state. I'm an American citizen. So I went over to the police officer and I said, officer, I've come to this lecture and I was told it was okay. And so he says, well, I said, if she said I can't come in or, I'll be arrested. He says, well, then I'm handcuffing you. I meant, you're what? You're handcuffing me for what? I mean, I wasn't holding signs saying,
Yeah.
what I wasn't doing any. I was just coming in to listen, right? And so I said, you're kidding me. So I started to go back out to my car because I wanted to call my husband, who was a U.S. attorney in Boston.
Mm.
And so I wanted to call him and find out. This looks like civil rights violation. So I'm
Mm-hmm.
coming out, and the head of several of my other clients were coming in and they said, we're going to put a wig and a mustache on you. We want you to hear the information so that we know what they're talking about because we may not understand everything. So I thought, well, I'd get arrested for anti-war, but not for chicken wings. So I said, I told him that. I said, so I called my husband and he said, no, that's civil rights. I said, I know. I mean, the school gets NIH money, they get state funding, they get
Mm-hmm.
federal funding. They can't just discriminate against you because they don't want you to hear what they have to say or you to go. This is terrible.
Mm-hmm.
So I called the dean of the vet school. It was Dr. Kosh at the time. Called him because he lived in Hopkinton, and I called him and I said, you don't threaten people with handcuffing to come to a public lecture at the university. And I had been on faculty there for 25 years. And the last 10 years I was volunteer, so they couldn't say you're fired. So, because I
Mm-hmm.
was volunteering to come in and give a guest lecture on acupuncture and chiropractic and herbs. And so I said, you don't threaten people with arrest. It's a civil rights violation. And you know what the dean said to me? I quote, you sue us, we'll squish you like a bug. We have
Mm-hmm.
so much money. We have such
Yep.
deep pockets. We will
Yep.
out hire attorneys and we're going to say terrible things about you.
Yeah.
And I thought, this is a drug cartel? What country am I
Yeah.
in? That they
It
can
pretty much
strong arm you
is.
so hard that you
Yep.
intimidate them, you would get intimidated. So my husband at that time was doing anti-terrorism and he had done organized crime. And I said, this is organized crime. This is terrible that you can't have freedom of speech at a university. That's crazy. So I had a case that took years to get to, but we had a case with the ACLU on freedom of speech, went to the Supreme Court, and we lost because exactly what the dean said. They
Yep.
hired 7 of the top attorneys in Boston that were getting, I had the ACLU and a small little attorney from Hopkinton. We were crushed. We were
Yep.
crushed by these screaming, like her horse is only worth five, like the whole issue was, they basically told me my horse would be dead in 2 days, which was wrong. They
Yeah.
basically, totally defamed me in front of all these students that if this was holistic medicine, this was malpractice, he should be euthanized. And then they threatened to arrest me to go to a public lecture. And now it's so ironic that 40% of pet owners surveyed in the United States feed some
Hmm.
portion of raw. So I was so
Hmm.
wrong to have myself arrested back then. So how do you stand up and say something when you see these animals that are improving with the care that you're giving them, the nutrition that you're giving them, and you have to lie and say that they must feed Hill's Purina that is being utilized by the university and the students are getting free food and the faculty is getting free food
Yeah.
and they're funded by the dog food companies. So this is corruption to me. It's,
Yep.
it's power of the organizations that help fund both the veterinary boards, that fund the veterinary school, that fund the law schools, that fund the veterinary medical associations. They're all in the same kind of direction of pharma. And it is important for us to have collaboration. I need drugs when I need them. If I need
Hmm.
anesthesia to put an animal under general anesthesia, I can't do that without the physical
Hmm.
drugs that we need. But if they can be done without antimicrobials, without NSAIDs, and doing it in a way that is not damaging the microbial diversity, and now that I'm writing a whole book on I have finished the rough draft and it's going to be editing, but it's on the miracle of the microbiome. And this is all the years of, cases that I've done with the microbiome. And, understanding that and understanding why we have to be so much more clear about how we're going to just take care of that animal because we could be completely destroying their microbial diversity.
Yeah.
So back to why this happened, I stood up. And so the board has been out to get me because the veterinary school's been out to slit my throat. They don't want a voice. They don't
Yeah.
want, the students are paying, I don't know what the tuition is now, but it's, probably $80,000 a year. And they're not getting all the information. They're now getting an acupuncture class offered, which I am so grateful that they
Yeah.
now have at least knowledge that there's something else to manage pain, manage inflammation in the body. But there's so much more that acupuncture can do for other organ
Yeah.
systems and everything else. They're teaching a pain management acupuncture course, but at least they're recognizing that acupuncture is an important modality that should be part of everyone's veterinary toolbox.
Yeah. I mean, everything that you just shared is it horrifies me, but unfortunately I know that this kind of thing happens, and sadly not enough people do know, but money talks. Big pharma and big kibble are running this industry,
Hmm.
and the same thing happens to human health professionals. I mean, Mark Hyman, they've tried to slander him. He's one of the voices of functional medicine. They've
Oh,
tried to slander
absolutely.
him for 20 years, 25, 30 years. And thank God men like him and women like you continue to persevere and speak up and do the right thing. But at the end of the day, I mean, this is exactly what happened to the scientists who tried to expose and speak out against Procter and Gamble 80 years ago when they brought seed oils into the industry and completely, changed the way the American Heart Association recommends we look at cholesterol levels.
Mhm.
The numbers that I am legally forced to discuss with patients or else risk malpractice about their cholesterol were influenced by two men who wanted to make money by turning machine oil into food almost 100 years ago. There
Wow.
are long lasting
No, it
impacts
is.
to corruption in medicine. So it
It's
exists and
very, very
people need to
hard.
hear.
And it financially, what I'm hoping is we can find people out there that will support what I've done. And
Yeah.
I need a veterinarian who's willing to have the
Yeah.
character to say, this is the right, we have to stand up for our profession. My
Yeah.
profession means a lot to me, and it's been extremely
Yeah.
financially, emotionally traumatizing. And, it's hard to be, truthful. It's hard
Yeah.
to be directly, and my clients want that from me. They want the truth from me, and they don't want
Yeah.
me to just lie to them. And
Yeah.
I can't, if I think I can help their animal with something else, I have every obligation to talk about it because I have that knowledge. But if another veterinarian doesn't have that knowledge and they just tell them there's nothing they can do, they're
Yeah.
100% right. I mean, that's not fair. That's not fair to that client.
No,
That they
it's
don't
not
have
fair.
any information about, even just changing the diet. Well, just switch from this kibble to that kibble or this prescription diet to that prescription diet.
Yeah.
And not understanding that they have to nurture that microbial diversity or they're not going to
Yeah.
get the immune system to function. And we know that 80% of our immune system comes from our gut. And if
Yeah.
they're giving more antibiotics, they're not really helping that. So,
So I think a good way to wrap up then, how do you feel the public, like what can the public do to encourage more collaborative care from their vets, whether they are, it says on their website that they're integrative, or if they're conventional, or if they're completely holistic? How would you
right.
encourage people to
Well,
just
I
raise
think that
awareness?
yeah, people need to demand that they want to know more about other modalities. The American Holistic Veterinary Medical Association, which I'm on the Council of Elders in that organization. We just had our conference in West Palm Beach. It was wonderful. I mean, it's like you're with your people that understand that there's opportunity to help animals in other ways, and it's such a joy to be with those individuals that are willing to think outside the box. And I think the veterinarians maybe they're afraid because they see what's happening to me. They don't want to have to deal with that, so they're not gonna.
Yeah.
They're just gonna stay in their their tunnel vision and not look at anything else because they don't want to get in trouble with the board, and the boards have to change. The boards have to
Yeah.
evolve. We're getting race credit to take courses in microbiome, in ozone, in chiropractic, and herbal, all that stuff. And they're not even honoring that stuff.
Yeah.
It's race approved, meaning it's credentialed. The faculty, I'm on a faculty at a university. I've studied this stuff and written books on it, written, 20, 30 articles on it. It's not good enough in Massachusetts. They don't want, they only if it's race approved by what they want it race approved. And that's ignorance and prejudice. And
Yeah.
if you don't know something, I admit it. I don't know something. I'll tell you, I don't know.
Yes.
You
You
know,
say, I'm not
I don't
sure.
know.
Let me look that up and I'll get back to
Exactly.
you.
And
Let
now
me
with,
consult with my
Google and
colleague.
AI, you can find
Yeah.
information. But when we've asked
Yeah.
people on the board to look at, or their expert witnesses to look at these different things, they look for 2 minutes and they say, well, we didn't see it, so therefore it doesn't exist.
Yeah.
Like, I've been studying this stuff for 30 years. I can give you 25 books you can read. I look for 5 minutes on the internet. I don't see it, so I'm not going to do anything about it. It's not. So that kind of superficial ignorance is not acceptable to me anymore.
Yeah. And it's not helping anyone. So,
Yeah.
yeah, I mean, if I could leave our listeners with anything, it would be educate yourself, think outside the box, demand better care, and don't let yourself be silenced. Don't let the professional that you're speaking to belittle you or make you question or doubt yourself or really guilt you into something, right? That you know your animal best at the end of the day. And you are also a part of the collaborative care team with your veterinarian, with your other healthcare professionals. So your voice matters. You are their best advocate, and this is how you advocate for them.
I mean, that sounds very good. And my hope is that this case has been submitted to the United States
Yeah.
Supreme Court with an amicus brief, and people can get a copy of that if they go on the Supreme Court and put my name in there, Margo Roman, and maybe we could put the links up on your website that people
Yeah.
can read this stuff and get outraged because
Yeah.
I can't. It's like you read it and you go, why did they attack her? She didn't do anything. All she did was try to give her clients
Yeah.
the education that they need so they can navigate their animal's health through this. And to say that I was, practicing out of the scope of veterinary medicine when we are part of the healthcare zoonotic team, to me was silencing intelligent education.
So, how can people find you? Can you give us your
Well,
website?
I have a Facebook, and I could try to give you those links to the Facebook. We have a Give, Send, and Go fund, which I thought was going to be inundated with donations to help me defer the cost so far. I mean,
Yeah.
it's been financially depleting, and I really need support from people that care about their animals and want health freedom for their animals. And I think this is right now with what's going on in our government today with freedom of speech, and
Yeah.
deciding, what the CDC is deciding on what is good and what is bad for our bodies to be getting into. It is important for veterinarians to have a voice in this, and pet owners that see that these opportunities to make a difference should should be allowed in our animals too, because the alternative is just euthanize.
Yeah.
They're euthanize, getting herself another dog. Well, that's not. I don't want to do that
No.
for my own dogs. I love my dogs, and if there's ways that I can navigate their health and help prevent them from getting something else, is what I've always tried to do.
Yeah. So I will put all of the links in the show notes. And
Hmm.
I am also going to put the title of your new book on ozone that came out in the show notes and a link there so that people can take a look at that and purchase and learn from that as well.
Okay.
And hopefully we can come on another time and talk more exclusively about ozone. But for this time, we're going to wrap
Okay.
up. Dr. Roman,
Okay.
thank you so much.
You're
This is
welcome.
something that I really hope people listen to this, share this with their friends, spread awareness, because we need to talk about it. It's a hard thing, which is exactly why we need to talk about it. So thank you for giving us your time. Good
You're welcome.
luck. I hope that you continue to get support, and I'll talk to you
Okay.
soon.
Thank you.
Bye, everyone. Thank you for listening. Please remember that you, yes, you, are the driving force that helps keep small businesses and platforms like mine running. So if you liked what you heard, please like, share, and most importantly, rate this podcast. It's the only way we can reach more people and spread the word about natural health. None of the conditions discussed or recommendations given are meant to replace the advice of your health provider. So if you have concerns about yourself or your pets, please confer with a human or animal health practitioner. Have a super fantastic day, and I'll see you next week.